Everybody knows somebody who has had cancer, and this is a case that needs to be looked into. Cancer is already a grueling disease with devastating effects, even in the face of the best medical care. How much more in our climate where healthcare is not as affordable and the quality is a challenge. And that is why we came up with the Cancer Aid Fund. Basically, we're building a trust fund to support cancer patients. In Nigeria, there are over 200,000 cancer cases every year and over 100,000 deaths from cancer. This is already a burden, and cancer prevalence is on the rise in Africa. When a person is told that they have a chronic disease, say cancer or kidney disease, in Nigeria or in Africa, it feels like a death sentence to them, because in Nigeria only about 5% have access to financial health coverage, what we call health insurance. So the remaining 95%, when they get diagnosis of chronic illnesses, either have to borrow, beg, or not seek treatment because they can't afford it. That is for the disadvantaged. And that is why we're doing something. We're trying to do something to help people who get diagnosis of chronic diseases in Nigeria. So now that we know that there is a problem and that cancer prevalence is on the rise, we started to ask ourselves questions. How can we make things better? In Africa, there is 1.1 million new cancer cases every year, and a high percent of that is breast and cervical cancer that can be prevented by early diagnosis and treatment. And that is why we created the Cancer Aid Fund. So we have two objectives for this trust fund. The first is to provide financial support for cancer patients, and we're calling it the 50% co-payment aid. We want to be able to provide at least 50% for every care that a cancer patient will need. So chemotherapy, radiation, maybe surgery, throughout their continuum of care, so that they can focus on healing. Cancer is already unfair. You not having money to pay for it after diagnosis makes it even more unfair. And that is why we want to do. So the first objective is to provide at least a 50% co-payment aid throughout the continuum of care. The second objective is geared towards prevention and early diagnosis. So for now, there is no cure for cancer, but they say that prevention is great, and early diagnosis and early treatment increases your prognosis or makes your chances of survival better. So we want to partner with the primary healthcare system in Nigeria, so that in every primary healthcare, people in that local government area can have access to regular time, so it will be timed, regular and free screening, cancer screening and diagnostic services. When they come in, they get tested for the cancers, like for now we have breast and cervical leading the chart. Those can be tested. So there's pap smear for cervical, and there is breast examination. And in cases where there are lumps, there could be lumpectomy, and treatment can be given. So that is what we want to do. That's our second objective, to do free and regular cancer screening and diagnostics in primary healthcare centers across every local government area in Nigeria. That reduces the prevalence, because we're targeting early diagnosis, and early diagnosis means early treatment, and that means the prevalence rate can reduce. One of the reasons why people are afraid to seek care when they get cancer diagnosis is because they don't even have the money to go get care. And another issue we're battling with in Nigeria, in Africa, is the poor health-seeking behaviors that we have. So a person would rather manage it with traditional medicine and all of those stuff. So if we do the cancer drives, the awareness drives, people know that there's an organization that wants to help them through this process or through this stage of their lives. We have 3 strategies to achieving this goal. The first is what we call the Art4Health shop. So we decided to start a social enterprise where we sell paintings, and Afrocentric pieces, fashion pieces. So when you go, it's an e-commerce store. When you go into the e-commerce store, www.art4health.com, and you buy a product from there, every proceed of that goes to the Cancer Aid Fund. So we're building a trust fund. So when you buy from there, from the December 3rd to the December 13th of 2022, every proceed from the sales of art, of paintings, of Afrocentric fashion pieces goes into the Cancer Aid Fund. Our second strategy is to partner with small, mid, and big-sized organizations, businesses, and corporations. So there's something called corporate social responsibility, and that is when they give a percent of their yearly or monthly proceeds to giving back to the community. And this is the second strategy through which we want to build the Cancer Aid Fund. Our goal is actually to build a multi-billion-dollar fund so that everybody who has cancer and are disadvantaged can actually get access to care. And our third strategy is your kind donation. So for now, our estimates say that $100 would help, is what a cancer patient needs per day from our estimations. So your $10, your $20, your 5,000 naira, your 10,000 naira is going to go a long way to help us achieve the goal of building that Cancer Aid Fund. For now, our goal is to help 10 cancer patients and children with chronic diseases through the continuum of care till they get better, and to help 1,000 Nigerians have access to early diagnosis and early treatment in primary health care centers. And our budget is 20 million naira to get that done in the first quarter of 2023. So yeah. Okay, my name is Kemi, the Changemaker, and I am the founder and program director at the Art4Social Impact, a registered youth-led development organization here in Nigeria. And we work to solve diverse social problems across multiple sectors, harnessing the power of partnerships and collaborations. For now, we are focused on providing quality and affordable healthcare to every Nigerian without fear of financial risk or burden. We created the Health Relief for Sick Children, where we provide financial and psychological support to children with chronic diseases and their parents. We've also hosted the Art and Music Festival in pediatric wards, and we've turned gloomy, sad wards to happy places.
Sing for me.
Our biggest hope in this season is to provide health insurance, financial health coverage to every Nigerian, especially disadvantaged people, so that they can access healthcare without fear of financial burden and risk. We understand that it takes all hands to be on deck to solve social problems, and that is why we're calling on everybody who knows somebody who has been affected by cancer or has heard a story of such persons, or you know somebody very close to you who has had cancer. We're asking you to please contribute to the success of the Cancer Aid Fund so that we don't have to see pictures or stories of people who have cancer asking for fundraisers and hearing eventually that they did not make it. And how can you support us? First, you can go on www.art4health.com and make a purchase. All of that proceeds goes to the Cancer Aid Fund. You can also reach out to us if you have a small or mid-sized or big corporation or business and you would like to do your corporate social responsibility projects with us. And lastly, you can donate your $10, your 5,000 naira, your $100, and your 100,000 naira will go a long way to saving a cancer patient and giving them hope again. Together, we can do this. Thank you.